My office oversees public-private partnerships for the administration and works with the private sector to not only build support for our programs and policies, but also to create a feedback loop with our private sector and with our employers to understand what innovative policies our employers are implementing, and to really understand what we can learn from them. You've heard this morning about what the de Blasio administration is doing to address the mental health crisis in our city. But if we really want to impact the health of all New Yorkers by providing access to services, by changing the culture, by addressing stigma, we need our employers to join us in a very real and deep way to get at these challenges. We all spend a vast amount of time in the workplace, and often that's where social norms are informed and reinforced. Public policies and programs help set a course in understanding and addressing the big challenges in our communities, but all employers can be very important partners in advancing these efforts. We know that a mentally healthy workforce can result in lower costs for businesses when employers and employees with mental health challenges are not treated sufficiently or treated at all. Employers end up paying much more in healthcare costs and disability costs. Data shows that a company that fosters a workplace that supports and improves mental well-being of its employees, it benefits from reduced absenteeism, increased productivity, and improved performance of the workforce. That benefits all of us, of course, our cities, our citizens, our communities, and our businesses. Today's panelists include employers and experts who have already recognized the value of investing and supporting emotional wellness in the workplace. And they are blazing a trail, truly, for other businesses to follow suit. We hope that you'll learn from this work and take it back to your cities and work with your employers and your businesses and others in the private sector to see what we can all do together to address the mental well-being of our citizens. I'm very pleased to introduce Dr. Belkin, who you've heard from this morning, and I hope you get as much out of this panel as we hope you will. Thanks so much.
Great. Good afternoon, everyone. We have talked before you went to the panels, and we'll keep talking about these key principles, these guiding key principles to anchor action and try to get some management over the range of things that we could be doing and issues that we are acknowledging have to be addressed if we're going to have a really effective public mental health strategy. And as we were developing those principles, and all our Thrive initiatives come from them, and I was listening to the panels today, I haven't heard an idea yet that doesn't fall into one of them, which is both a blessing and a curse. So it's a good organizing framework, but a lot of the stuff in there, and in Partners with Community, Act Early, Closing Gaps, we heard a lot as we were developing Thrive about the workplace and the importance of the workplace as a place for mental health, as a purchaser of mental health insurance, as a place where people often go to find their way through these systems. And while those principles capture a lot of stuff, it's often a lot of stuff that cities don't have direct control over. We have some ways into the private sector, but a lot that we don't. But what cities can do is convene these other actors. And we've been really lucky to have a very responsive business community, large employers, work that was well-traveled before us by the Northeast Business Group on Health, by NAMI in New York City. And just the convening power of cities can get to a lot of those things that fall into those buckets that seem not quite the city's responsibility, but actually where cities can make change. And we think one of those has to be around what happens in our workplace. It's where we spend most of our daytime. For many people in this room, it's where we spend most of our time. And it is a place that can foster mental health and promote mental wellness. And you're going to hear about some of those best practices, some ideas of where large employers and all employers can go, and also ideas about what cities can do to move the private sector along and help them move along in this direction. So you're going to hear from, and I'm not going to go into the bios in detail, they're in your materials. But from my left to right, Clare Miller, who's the director of the Partnership for Workplace Mental Health, Dr. Michael Rendel to her left, who's medical director of who's the global head of benefits and managing director at Goldman Sachs, Nancy Spangler, president of Spangler Associates, Sandra Turner, who's the director of the Americas director of EY Assist, Hyong, who's the chief psychiatric officer for Aetna and the head of Aetna Employee Assistance Program. And so we're just going to start. I'm going to ask each panelist in turn to just very briefly describe what you're most involved with that you think is a big innovation that people should know about.
Thanks, Dr. Belkin. I'm Clare Miller, the director of the Partnership for Workplace Mental Health, which is a program at the American Psychiatric Association Foundation. And so I want to just start by thanking you for the opportunity to be here today and telling you a little bit about what the partnership does. Number one, we are really, and I hope you will consider us, a resource for cities in this work to advance mental health. We're a collaborative program that works with employers to help them pay attention to mental health, take action around mental health, and invest in the mental health of their employees. We have three primary strategies. We've talked a little bit throughout the day about data, and that's one of the things that we do for employers is package data as new studies come out that really underscore the high prevalence of mental health conditions and the ways in which they affect their company and their company's bottom line. Make no mistake, this is about people's lives, but we recognize that for many people, we need data, especially within our systems, to make changes. And so wherever possible, when we have data that looks at that economic impact, we're going to make sure that employers have that. One new tool that we'll be bringing online in the new year is a depression calculator that will allow an employer to put in their demographics, industry type, location, et cetera, and it'll show them the ways in which depression in particular, which is very common among people that are employed, affects their bottom line and lost productivity, absenteeism, some of the ways in which we've talked about those issues today. And then, importantly, it will talk about the return on investment when an individual gets access to care. So those are the kinds of tools that we use to help employers really kind of understand the impact around mental health to their bottom line. The second thing we do, and I think in some ways the most important thing we do, is we identify examples of what companies are actually doing, and then we tell those stories. So this is not about APA wagging its finger, at the business community. This is about talking with the business community, finding out what's working, and then sharing those ideas and stories with other employers. It's been really gratifying to see how willing employers are to share what they're doing and to be resources to one another. And I think that that's an incredible role that cities can play in terms of convening employers to just talk with one another about these issues. We actually have a couple of cities that have contributed what they're doing as an employer. And that's another thought that I've had as we've been sitting here today, is that you are leaders in your own right as employers. And let's not forget, with mental health parity, for example, it was city, county, state governments that were some of the first to adopt mental health parity. And then the last thing that we do is actually give employers free resources and programs that they can use at the workplace to increase awareness and connect people to the existing services that are available to them. For example, employee assistance programs, mental health benefits, et cetera. So we have two programs that an employer, one is focused on depression, called Right Direction, and the other is actually called ICU. It was developed by DuPont and then given to the partnership to make it available to other employers for free. So our resources are available to you. I hope that you will hear this as a message that APA wants to be helpful to you in advancing this work and being a partner and a resource. Thank you.
Thanks. I wanted to talk briefly about our strategy and how it really started beginning in 2008 with the economic downturn, and really I think all financial services companies had particular stress, at that time, both internally and externally. I think all companies were going through layoffs and downturns, but even externally, financial services companies, there was a spotlight on them in terms of, responsibility for the economic downturn. And so we knew our employees were stressed, and we wanted to get them engaged in making sure they were taking good care of themselves, not just looking at people with active, acute mental illness problems, but everybody, making sure that they really took good care of themselves both physically and mentally. And so we really sort of renamed the program Resilience and really went through sort of three different strategies: awareness, training, and then clinical support. And in order to get awareness, we had senior leadership sort of lead the way, and we brought in experts in all different kinds of areas, not just around depression. So we wouldn't necessarily bring into a talk on depression, we would do a talk on happiness. So we were trying to take a positive spin that everyone could relate to. And so we got everyone engaged in understanding that being mentally fit was something that was part of what they should be looking at, whether they saw themselves as having a disorder or not. And really tying that to performance and saying that if you wanted an edge, improve your cognitive skills if you wanted an edge in terms of doing the best you can. And people at Goldman are motivated to do the best. They like thinking of themselves as the best, and they want to do the best they can. And the idea that if they went to listen to the sleep expert or the nutrition expert so that they could have a competitive edge in terms of the quality of work they produced, that really got people engaged and started the conversation going. That really led to an idea about how do you manage the stress of life. And so we launched an entire curriculum around stress management, mindfulness, working parents, and then another series of curricula for managers in terms of positive psychology, identifying mental health issues in the workplace, where we really tried to get everyone engaged so that when we offered clinical support, and we really, one of our key tenets at Goldman is to bring the support to people. So whether that means doing the flu vaccine program up on the floor so people don't even have to go take the elevator to get their flu shot, it also means bringing the clinical support. And so we brought a lot of on-site counselors and on-site physicians on-site and had a lot of success on that. And since that time, we've actually exported that globally. And so we have the same kinds of services now around the world, in Asia, in India, and the UK, and now and here in the US.
Excellent. My role here today is to share information about the Community Initiative on Depression that Kansas City launched some time ago, and to share my learnings since then. That initiative brought together employers, health plans, city, state, and county governments, both as providers of care, but also as major employers in the city. The American Psychiatric Association helped sponsor a national level meeting, bringing people to Kansas City, and we also had a town hall meeting that the Chamber of Commerce sponsored. Through that experience and then working with employers since then, three major learnings that I want to share with you include: one, that employers adopt new benefits and programs when they see someone else adopting them. There are few employers that really want to put their neck out there and be the one to start this. So the role of the city as conveners is really critical, bringing employers together and having a few who show up as willing to share what they've done and to stick their neck out is really a great role for the city. When employers collaborate with other community groups like clergy, schools, foundations, it's really a way of having a common language around mental health, and that communication and collaboration reduces the stigma that holds people back from seeking treatment. Secondly, simple communication programs encourage people to seek care and to learn new information. And I mean simple. We did a simple brochure. The CEOs of each company sent out a letter to all employees and managers. Some employers did manager trainings and employee meetings to share information about depression and the resources that they already had. By looking at the care seeking, we did see about a 38% increase in care seeking, counseling scheduled counseling sessions scheduled, as well as 78% increase in website access. So people wanted to learn new information once they knew that it was there. The third point is that if we look at mental health in the same way that we look at physical health, why are we not doing more related to prevention and skill development? We would not, in this day and age, expect to wait for someone to have a heart attack before they get care. Care is caring. What I've heard time and time again from major employers who feel they're doing something well is that it's not just the benefits that they provide, it's the care through their culture that supports health and high performance. Those two can sometimes conflict with one another. The stress of being pressured to perform at a high level can be intimidating and stress-producing. But when we teach people that stress is not the enemy, that we can recover from stress, and that people are highly resilient, that can be a very effective way of learning. So those are my 3 points.
Thank you, very good. Good afternoon. I have to begin by saying that when I walked in here this morning, I was dumbfounded. It was so awesome to see all of you in this room. It's just spectacular. And it takes me back because my first role in working with an employer on behalf of mental illness and addictions in the workplace was for Cuyahoga County in Cleveland, Ohio, in 1977. All these many years later, being now in the private sector at EY, Ernst & Young, one of my very profound learnings is that the public and private sectors certainly have a lot in common when it comes to addressing this issue. We're all coming to realize the profound negative impact of these conditions on the functioning of our workplace. It's a health and wellness issue, it's a safety and security issue, and certainly productivity and innovation. So I wanted to tell you, give you the Cliff Notes version of a long story about how EY has stepped up to be a leader in addressing these conditions in the workplace. And the story is in 4 chapters. And the first one has to do with building a culture of caring. The second is making the business case. The third is developing the unique initiative for our workplace or your workplace. And the fourth is following up and keeping the message and accomplishments in front of the leadership. EY prides itself on having created a culture of caring because of our values-based leadership, our benefits package, our accessibilities program, which serves as a champion of individuals of diverse ability in the workplace. Our employee assistance program called EY Assist, which includes peer-led support groups for adult caregivers, for parents of children with special needs. Our high-performance teaming, where every team member has a responsibility of caring for everyone on the team, and our diversity and inclusiveness network, which again addresses culture, ethnicity, sexual orientation, and diverse abilities. So that's really the first chapter, the context into which then you launch a very special initiative to address mental illness and addictions, which is apart from the EAP, it's apart from a wellness pillar, apart in the sense of focusing more directly. Making the business case to the leadership is the second step, and once that's been approved, then what we did was convene a group, including professionals from the community like NAMI, which is a very special organization, folks from our general counsel, from benefits, from diversity, from EY Assist. Probably one of the key players that we don't often think of is our communications and promotion people. Too often we develop a good program and we hide our light under a basket, and they can be really key in getting the message out. There are initiatives already in place, like Claire mentioned earlier, ICU, that NAMI has a variety of other models. We decided to create one ourselves and called it Are You Okay? And we brought this team together, and over the course of about 10 months, decided how we wanted to craft this initiative and deliver it. And as I heard some of you speaking this morning, it really involves training key individuals in the workplace, our leaders, our human resources team, our peers, how to ask the question, how to listen, and how to refer, and what those resources are in the workplace. We didn't think of announcing this to the firm, which is 45,000 people across the country, until those folks who are key contacts knew what it was about. So once it was launched, again with the help of communications, and I won't go into all the detail, it was like tapping a rich vein, and the response from all levels of the organization has just been remarkable. And it goes back to the fact that 1 in 5 have some mental health condition or their families are affected. So again, it was not surprising, but it was shocking. If you want to put it that way. And finally, to close, we keep very close communications with our leadership so that they know the stories, they know the data points, and will continue to support us over time. As a community citizen, EY has a mission statement that says we want to make a better working world. That certainly starts with our own people. It extends to our clients, like Goldman Sachs, and beyond that into our own communities. We're in 95 cities across the country, so don't hesitate to call upon us to become part of your local partnership. Thank you.
So it's incredibly proud to participate in such a great panel. Dr. Belkin mentioned that most of us spend time at work, and then we go home, and then we have all these responsibilities at home. So it's no wonder that 30% of us experience moderate stress, and 20% of us have diagnosed with behavioral health issues. And that's no different for Aetna. We have 50,000 employee base and a 17 million member customer base. So one of the biggest focus at Aetna is really focusing on stress and stigma. So related to stress, we have several initiatives. We have basically instituted mindfulness throughout the organization, both in training and practice, mindfulness-based leadership, and that culminated in actually a cultural change, a cultural champion in the person of a chief mindfulness officer. So that has really significantly helped to start a different kind of discussion about stress, how to optimize your response to stress, how to be more resilient. So that's been an incredibly important thing. Now, even if with mindfulness and all kinds of activities, you're still going to have stuff happen at home and stuff happen at work. You got legal issues, you got child care, elder care issues, you got financial issues. So we really focused our EAP activities. We're going to continue to have really strong behavioral health services, but we focused our EAP to really focus on all the work-life issues that we all struggle with. Today I had to make sure I had someone take care of my dog so that I can get here, right? So we need someone to arrange for pet service, right? So even those little things that kind of seem trivial add up and impact our productivity and our overall health. So we really have led with our EAP program. We don't even call it an EAP program. We call it Resources for Living. So it really indeed is the Resources for Living. Now, once we have those things, we still need to deal with stigma. Stigma is a big issue. And what we really need to do is provide tools to fight stigma, but also to increase mental health literacy. So we have actually instituted within Aetna, and we've offered to our customers something called Changing Direction, a way to recognize the different types of issues you can get into. And then once you identify them, what do you do? How do you deal with that? And so we have actually instituted mental health first aid within the company, and we offer mental health first aid to our customers as well. And then once you offer that service, so you identify distress, you identify mental health issues, you offer first aid, then what do? You need to provide access. So apart from the kind of access to our 100,000 behavioral health providers, we need to provide other types of access. So we really have focused on technology-based access, whether it's a access through telemedicine, so televideo counseling, telepsychiatry, or through online activities. So there are online cognitive behavioral therapy sites where you can start to get some self-help and self-management of your mood, and do that as the beginning of your journey to health. So we offer all those services in a kind of integrated way with EAP kind of tying this together. So that way we can make sure we have recognition, we have ability to self-serve, we have the ability to access providers in the milieu, the culture that really focuses on mindfulness and actually even yoga. So that's some of the things that Aetna is doing.
Great. So thank you. And I'm aware that we got a late start, but it was very important to attend to your well-being and let you get lunch. So I'm going to ask a couple of questions to elaborate, and I'm just going to ask anyone to jump in, but to jump in concisely. So we've heard along the panel a whole bunch of evidence-based practices, things that are increasingly written about and evidenced, culture and awareness change, skill building and self-care, assisting and helping people access care and methods to do that. And while those are fairly simple and shown to be effective, they're not the new normal yet. In thinking about what you think are the obstacles to that, of those things becoming the new normal for our workplaces, what of those obstacles do you think cities can do, can these people do, to try to accelerate happening?
So I think, you mentioned convening, and that is an incredibly important power that you have. All the private sector, all the companies that we represent live in communities. And convening those communities to talk about these issues and providing a forum, a safe forum where you can talk about those issues is really critically important. And we health plans listen to our customers. And if our customers come in after having a meeting with you in your cities, they come to us and say, in fact, Northeast Business Group Health did this, okay? They come to us and say, well, what about this? What are you doing about this? So we can really then play a part and have a role in the community.
I also think knowing your audience is important. So, and this idea of segmentation, I think there are some themes that are going to be universal that'll appeal to everyone. But as at Goldman Sachs, we're not going to give the same program to our investment bankers that we would for our technologists. And we might have programs for women and what women's concerns are that would be different than men's. And I think we've looked at the life cycle of an employee. And so a starting analyst is going to have different concerns as a millennial than someone who's starting a family versus someone who's more senior. They each have their own stresses that they need to manage, and we try to tailor programs for each part of the employee population. I think cities could sort of do the same in terms of tailoring messages and programs.
And one thing we're looking at is developing a learning network across employers. And Nancy, it sounded like that was something that you, at least a part of what you were doing in Kansas City. And what was the traction of that, and what did city government contribute to helping that be successful?
Well, as I said, city government participated as care providers and as employers. And one of the things that I found extremely interesting was when we scheduled monthly meetings for the employers to get together and share what they were going to do, what their plan was for this communication campaign internally. And each month it got a little bigger. People would share something, and then a next employer would get an idea, and they'd be eager to be the next participant sharing what they were doing, and it was as if you'd lit a fire and it was growing. So that was really interesting. I also wanted to share that I think it's really important to get together CEOs as a group, but also other levels of management employees with the CEO. I mean, you hear of a CEO roundtable, you hear of a benefits roundtable, and they're separate silos almost. I think it would be really interesting if we could do it to get several employers who would bring their team with communications. How it is, let them be the spokesperson for how can you really create something where it's very high-level communication as well as the leaders showing an example. That's what needs to happen. Leaders need to be mentoring and using common language to get the message across.
In one ways, cities and local governments can lead by example, is similarly seeing themselves as employers, many of which are very large employers, to adopt the sorts of things that you've done or helped other people do. Based on your experience, what advice would you give cities and localities about how to start on this journey of themselves becoming effective and good models for implementing some of these practices?
The convening part and bringing together the disparate pieces within an organization, I think, is really key. So having people with the common goal of how do we address mental health from prevention to early detection to treatment for people who are seriously disabled. How do we as an organization live out the set values that we've espoused and bring the different pieces together with that common goal?
Well, and I would just add, again, you spoke earlier today about the epidemic of opioid addiction in the community. Having a burning platform like that, so to speak, to convene. I think the timing is excellent because these are our employees. They're your residents. We have a common critical interest here.
And if I could just jump in, also I think an area of intersection for employers and cities is around some of the challenges in the fragmentation in the delivery system, which can only be solved really on the local level with all of the stakeholders working together. And I think if you include employers in some of those discussions, you can push some of the initiatives that you might be doing around integration, for example, but also work with them as purchasers in their own right to be asking similar questions, for example, of plans and having similar messages about the importance of primary care, coordinating with specialty, those sorts of interventions.
So I want to push that a little bit, the idea of employers as purchasers and that as a way for them to shape benefits and parity and care options and access. Where have you seen that work, and how, again, can government be a catalyst for especially large employers to be more attentive to acting in the marketplace for progressive change in the way that they potentially can?
You're an actual purchaser.
I'm a purchaser, so
Why don't
I
you
guess
talk?
I'll talk about that. I mean, I think it's a challenge in the area of mental health. I think that, what employers have been doing, partly because of the Affordable Care Act and the mandate around the excise tax, is that they've been changing their plan designs, and the marketplace has been moving anyway, and sort of devaluing the plan design with a lot more co-sharing of costs with employees and with family members. And I think to that effect, some of us are trying to put a bulwark around, like, what is the maximum we think that individuals can really withstand, and we want people to not access care because of cost. And so I think one of the things as employers we look to is to make sure that our people have access to the right services and what they need. And I think in mental health, some of the challenges are the way the provider community is built, and a lot of those providers, don't participate in insurance plans, and that's been a particular challenge for us. I think in the community, it's for cities, it may be more just a lack of enough providers, period. And so I think in the same way that we're looking for high-quality providers, I think cities should be looking the same way.
I certainly would agree with your comments. The access in the community, the lack of professionals certainly is a big problem for all of us. The employee assistance program really can be an interim solution in the sense of providing the opportunities for assessment and treatment of shorter term issues before referral into the community. So it's a good interim solution, but again, we really need to be doing more together to address the broader need.
Most municipal and city governments actually have very robust EAP benefits and have robust utilization. So whatever you're doing related to encouraging utilization, that cultural change, that kind of permissive environment that you said, I think is critically important to replicate. And also in terms of the benefit, I think you actually have fairly significant EAP benefits with richer counseling sessions, face-to-face sessions. And I think that's helpful, particularly in light of some of the benefit constraints that you're talking about in some ways. But EAPs, despite that, are underutilized, and I think it's a very important service to promote, whether you're doing that as an employer or whether you're convening your private company to really continue to encourage EAP utilization.
I think another area is technology. We see such growth in technological solutions for education. We're educating, we're teaching people different skills and ways to recognize when their condition has changed, when their thinking has changed, when their mood has changed, when their behavior has changed. There are lots of things we can do in terms of education as well as web-based treatment, and that can reduce some of the disparities and increase access in rural areas, certainly, but even within the city where there are, we talk about food deserts, and we have mental health care deserts as well.
So I'm getting the signal that our time is near up, but I want to see if we can entertain a question or two. Question, yes.
So how do you train managers in the workplace for early detection of problems coming so that a lot of our clients burn all their bridges and then have a hard time going back to work? What advice do you give managers?
So there's a terrific training program that we use called Mental Health First Aid. It was developed by National Council, came from Australia, I believe. And there's both a longer training, which I think lasts 8 hours, and then there's shorter training for workplace, which Aetna actually supports, which is 4 hours. But I think what's really important about that is that you can also create a group of trainers. I mean, what Aetna has done is created a group of people who have now become trainers who train people within Aetna, but also train people within the community as well. So you can actually have both a company effect as well as a community effect. So mental health first aid is something to really, you might want to look into.
I think one of the things that managers often trap they fall into is they're well-meaning, but they go too far and they're trying themselves to deal with the problems that their employee has instead of referring them to resources. So a lot of our training centers around, here are some warning signs, this is what you should do, but also this is what you shouldn't do. And I think that gives them a very clear line about how they should respond when they recognize a problem.
Yeah, related to that, most of your EAP benefits have management consultation as part of the benefit. It's very underutilized, but there are groups of people who have both behavioral health and HR background who can support your managers in kind of maneuvering that boundary that often is very difficult to do.
And for some managers, it's kind of the other extreme where they are fearful about having a conversation, worried about how they're going to respond to whatever is stated by that employee. So again, I think training like the one that we do, Are You Okay, is really designed to help managers, supervisors feel more comfortable in just eliciting information, asking, are you okay, based on what they're observing, changes in behavior, attitude, demeanor, appearance, et cetera. And then knowing that they don't have to answer the question, they don't have to solve the problem. Here are the resources that you can use. So giving them, increasing their comfort zone, I think, can make a big difference. And as we all spoke about earlier too, that whole culture of caring. So it can't just be training about one issue related to mental health or addictions. It's really about accommodations, about accessibility, inclusion. That's the context that makes this work.
I worked with Mental Health America of California, and they did a statewide program on they called it Wellness Works, but it was mental health training, and part of it was manager training. I got to do an evaluation and interview some of the managers who participated. I was just struck by the number of times people mentioned that a simple sheet that they were given that had sample phrases to use in difficult conversations that they kept in their desk drawer. Another example was encouraging managers to talk with employees to prepare for difficult meetings. There was a man who, they were doing downsizings, and there was a man they were concerned about because they were going to have to let him go. And they had alerted security, and they asked him what could make this meeting go well for you, and he asked to have his wife attend. and the meeting went very well. They never would have predicted that, and they never would have offered that. So simple things that you can learn to train managers to do are very effective.
And I think we can entertain one more question. No more questions. You guys are super complete. I just want to note that a lot of the discussion has been around effective strategies that address anxiety kind of issues, mood kind of issues, but to also recognize that employers are often the point of entry by which people navigate care for schizophrenia, for bipolar illness that's erupted in them or their family. And the more we make our workplaces credible, comfortable, easily navigable points of contact to address the range of things. There's no picking or choosing here. The range of things. We make them real structures and partners in building a public mental health strategy. So we encourage people to think about the ways that you can foster and accelerate those kinds of partnerships and that kind of action by employers in your communities. So thank you to the panel. Thank you, everyone, for your attention. It is my duty to, apparently it seems to fall on me to tell you where to go. So the next series of panels, yes.